So the CAPTIVATE study is a frontline study for patients with chronic lymphocytic leukemia younger than 70, where patients received 3 months of Ibrutinib single agent and then 12 cycles of combination therapy. They were evaluated for their MRD status at end of the 12 cycles of combination therapy. Patients who were confirmed as undetectable MRD, and confirmed undetectable MRD required 2 determinations to be undetectable, separated by 3 cycles, and undetectable MRD in blood and bone marrow at 10 to the minus 4th sensitivity, which was evaluated by 8-color flow cytometry. And patients who were confirmed undetectable were randomized to receive continued single-agent Ibrutinib versus placebo. Patients who were not confirmed as undetectable MRD were randomized to continued combination therapy with Ibrutinib plus Venetoclax versus Ibrutinib single-agent. And the primary endpoint of the study, and the primary endpoint that I'll be presenting, is the 1-year disease-free survival for the confirmed undetectable cohort, comparing the patients who received placebo versus continued Ibrutinib single agent. Patients were stratified in the randomization in both arms by IGHV mutation status, and disease-free survival was defined as patients who did not relapse with regard to their MRD, and MRD relapse in this definition required rise in their MRD measurement to 1% or higher from undetectable, or clinical progression of disease or death by any cause. And the primary results confirmed that there was not a difference in 1-year disease-free survival between the placebo arm versus patients who continued Ibrutinib single agent at the 1-year disease-free survival follow-up. And there's additional analyses that we'll be presenting, for example, the MRD status for the unconfirmed group between the 2 treatment arms, and safety data as well. We did not identify any safety signals with this study, and we do see with the unconfirmed MRD arm, there are patients who continue on treatment, and there are patients who have improved their response with the continued treatment. So the key results are for the confirmed undetectable MRD arm, that was when patients were randomized to receive either placebo or continued Ibrutinib monotherapy. The 1-year disease-free survival was not statistically significantly different between the 2 treatment arms. The placebo arm had a 1-year disease-free survival rate of 95%. The 1-year disease-free survival rate for the continued Ibrutinib single agent was 100%. And again, 1-year disease-free survival was defined as patients who did not relapse with regard to their MRD to a level of greater than 1% in the blood, and did not have progressive disease, and patients needed to be alive at that 1-year time point. That is the primary endpoint of the study. And again, other endpoints will be presented, such as safety, as well as reduction in tumor lysis risk with a 3-cycle lead-in of Ibrutinib single agent, particularly reduction in the high risk for TLS with Venetoclax initiation, going significantly down with Ibrutinib 3 cycles of monotherapy or single agent prior to Venetoclax initiation. Other endpoints will be MRD rate in the unconfirmed MRD cohort between the two treatment arms, those being Ibrutinib monotherapy continued versus Ibrutinib plus Venetoclax. Targeted therapy having significantly changed the landscape of how we manage patients. This trial is a multi-center study, actually an international study with combination therapy, which demonstrates a very high rate of undetectable MRD in patients who received the 1 year of combination therapy or 12 cycles of combination therapy. I think the take-home message from this study is that for those patients who have confirmed undetectable MRD, if we stop treatment and give a fixed duration of treatment, at least the 1 year disease-free survival, as we've defined it in this study, is not different for patients who continued Ibrutinib single agent versus placebo. So we have data now that supports a rationale for giving fixed duration treatment with an expectation of a reasonably long duration of response with discontinuation of treatment. And so this is a large study that's a multi-center study that has demonstrated activity with combined targeted therapy with very deep remissions and disease-free survival as we've defined it, which is significant, including for patients who are discontinuing treatment.